Hello and welcome. You're watching our special show, Health and Wellness Save a Life. I'm Gargi Rawat. It's a sad but true fact that the number of people dying from cardiovascular diseases is steadily rising in India. Most of these cardiac deaths are sudden and on the spot, and it is possible to prevent these sudden cardiac deaths if the affected receive immediate medical attention and CPR. The recent incidences of some celebrities collapsing suddenly and passing away due to a heart attack are eye-opening and shocking. There is an alarming rise in the number of young patients with heart attacks and sudden cardiac arrest. What is equally scary is the sudden cardiac death may happen in people who have no known history of heart disease, and the risk is higher for patients with existing heart disease. Many adults in cardiac arrest can be revived with intact neurologic function if the bystanders provide immediate CPR. Raising public awareness and understanding of the practical applications of CPR is an essential strategy to increase CPR success in cardiac arrest cases. Now, Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. We have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We're joined by Dr. Mahesh K. Shah, consultant interventional cardiologist, MK's Heart Care, Mumbai, Dr. Amjad Sayyed, the chairman and interventional cardiologist, Noble Super Speciality Hospital and Research Center, Solapur, and Dr. Naresh Munot, a consultant and interventional cardiologist, Munot Heart Center and Research Center, Pune. Thank you so much, doctors, for joining us on the program on this very, very important issue. Dr. Shah, first question to you. The increasing prevalence of sudden cardiac death has made SCD a major global health problem. What are the causes of sudden cardiac death?
Well, Gargi, there are a lot of causes for sudden cardiac death, but the commonest cause is heart attack or blockage by atherosclerosis, blockage by cholesterol, as everybody knows. Apart from that, there are many conditions of heart muscle like cardiomyopathy, any defect in valves, valvular heart disease, even use of recreational drugs like cocaine, etc. can cause certain birth defects in the heart like ASD, VSD, complex congenital disorders. There are certain disorders of electrical system of the heart, channelopathies that also can cause sudden cardiac arrest. Kidney disease by inducing a lot of electrolyte disturbances, lung disease, thrombosis in the lungs, pulmonary embolism, what we have seen in COVID cases. These are all potential causes of cardiac arrest. But it's important to know that if you are facing a person with a cardiac arrest, cause is inconsequential at that time, action is more important, and within a few seconds, you have to start your CPR without worrying about the cause.
All right, Dr. Sayyed, it's said that men are significantly more likely to have their heart stop suddenly compared with women. Is this true?
Yes, of course. If you see the incidence of sudden cardiac death or sudden cardiac arrest, it is more in men than women. Even according to the data, statistical data, and recent data from Denmark, the cardiac arrest or sudden cardiac death is more common in men. There is a reason for that, because most of the diseases which leads to sudden cardiac death or sudden cardiac arrest are more common in men. Of course, if to say the age-wise incidence, the men between the age of 30 to 50 have highest incidence of cardiac arrest if compared with the women. But otherwise, women also have a significant degree of incidences cardiac arrest, and it depends on the causes also. Like the causes of non-heart attack causes, like one is the most common cause is the heart attack, that is coronary artery disease, which is of course more common in men. And the risk factor for this coronary artery disease are also more prevalent in male or men. So obviously the incidence of cardiac heart attack and cardiac arrest is more common in men. And if you see the non-cardiac heart attack causes of cardiac arrest, which are like cardiomyopathies or the arrhythmogenic diseases and inherited disorders or defects, these are also common in men. So overall, the incidence is high in men as compared to women. Of course, for every broken heart, women is responsible. So that's how we have more incidence of cardiac events in men.
All right, Dr. Munot, now we're talking about cardiac arrest, but if you can explain to us what is cardiac arrest and what does a person go through when he or she has one, and how is it different from a heart attack?
Thank you for the question, Gargi. So it is very important for us to know the difference between a heart attack and cardiac arrest. A heart attack is not the same as a cardiac arrest. In a heart attack, one of the arteries of the heart is blocked, and because of this the heart is injured, but it is still functioning. On the other side, when the person has a cardiac arrest, the person's heart has stopped. The person becomes unconscious, he will suddenly collapse. And a cardiac arrest can happen because of a heart attack, or it can happen because of some arrhythmia, some irregularity in the heart rhythm, or because of some cardiomyopathy. So basically, cardiac arrest is an electrical problem, while heart attack is a plumbing problem for the heart. And many cardiac arrests in adults can happen because of a heart attack. So either ways, whether it is a heart attack or a cardiac arrest, both are emergency situations, and you should call 108 straight away.
All right, so that's important to know that. And Dr. Shah, if not treated immediately, sudden cardiac arrest can lead to death. How can CPR help revive a person who has had a sudden cardiac arrest?
Well, CPR is one of the most important thing which has happened in the management of sudden cardiac arrest. When the heart stops pumping, there is hardly few seconds. Within a few seconds, the person is going to lose his consciousness, and within a few minutes, the major organs will stop functioning. So it's very imperative that within a few seconds, we start the circulation artificially by external cardiac compression. Now, this external cardiac compression needs to be learned, though it is very simple and it is practically child's play, but a small training is required. I would implore that majority of people, particularly organizations like airport, like malls, like cinema halls, police stations, schools, etc. should have CPR trained people. In fact, my recommendation is that every person in the country above the age of 10 should have some training of CPR. Just by doing a proper CPR and maintaining the circulation till the paramedic team arrives or emergency team arrives, which can be within few minutes or up to 1 hour, you can maintain the life by doing CPR, and CPR needs to be learned by as many number of people as possible. And just by training just 10% of the population, we can save tens of thousands of lives every year if bystander initiated CPR is performed.
All right, Dr. Sayyed, is CPR recommended for both conditions, cardiac arrest and heart attack?
See, the CPR is done when there is a cardiac arrest. Means the patient has stopped breathing, stopped responding, and there is no pulses. If you don't feel the pulse of the patient. But now you ask the question whether heart attack and cardiac arrest, they are two different things. There is a myth or there is a misunderstanding that heart attack and a cardiac arrest is the same thing. Cardiac arrest is a condition when the heart stops. When the heart attack is a condition in which there is a blockage in the coronary arteries and there is a chest pain and the presentation is different. And in heart attack, not necessarily all patients goes into cardiac arrest. So once the patient goes into cardiac arrest, whether it is because of heart attack or it's because of any other condition, you need a CPR. So you need to diagnose the condition of cardiac arrest by seeing the carotid pulse. Neck pulse can be felt if the patient is alive or the heart is still functioning. If the neck pulses are not felt and the patient is not responding to command and you don't see the chest breathing, then you have to start the CPR. So anyway, if there is a cardiac arrest, CPR has to be immediately done because the brain can sustain only maximum 5 to 6 minutes of ischemia. So before that, you have to start.
All right, Dr. Munot, how would a layman know whether he is performing the CPR correctly? Because that's also a concern. What results should one expect from CPR, and in how much time are results expected to be visible?
So it is very important for people to know what is correct CPR, what is effective CPR. So whenever you see somebody who has got a cardiac arrest, the person should first be kept on a flat surface which is stable. You should give compressions at the center of the chest, preferably with both your hands together, with your hands locked and your elbows locked. There should be a 2-inch chest compression minimum with every compression in adults. Also, the speed of the CPR, the rate of CPR is important. You should give compressions at the rate of 100 beats per minute, and also you should give 2 breaths after every 30 compressions. So this is when you've got a single person giving CPR. If you have got 2 people who are giving CPR together, so then you can give 2 breaths after every 15 compressions. One more thing is you should give adequate time for elastic recoil, so that the heart will fill with blood again before you compress it again to push the blood forward. Another important thing, nowadays the American College of Cardiology is focusing more on compressions, airway breathing rather than airway breathing and then compressions. So it is more important to give compressions, and airway has the next place. One more thing, that if the heart has stopped, then within 15 seconds a person becomes unconscious. Within 30 seconds he will stop breathing. Within 5 to 6 minutes his brain will start getting damaged, and after 10 minutes permanent brain damage will have set in. So it is very important to start CPR immediately and to continue CPR till you get some medical help, or till the person regains consciousness, or till you get a palpable pulse.
All right, Dr. Shah, if a person who's recently undergone open heart surgery has had a cardiac arrest, then can we perform a CPR on such a patient?
Well, there is a genuine concern about a post-bypass patient when you see a long scar across the chest. Obviously, the person who performs CPR is likely to be scared, but believe me, it is safe to perform CPR in a patient who has been recently discharged from the hospital. Of course, if the patient is still in hospital and connected to monitors, etc., the protocols, etc., are different for medics. But once the patient is out of hospital and a layman sees the patient losing consciousness and there is no pulse, it is very safe to perform CPR even in a patient who is post-bypass.
All right, so all very important points. We have a lot more questions for our doctors, but for the moment we'll slip into a short break and return with more. Stay with us. Welcome back. You're watching Health and Wellness, Save a Life. We're trying to understand sudden cardiac death and the role of CPR to revive and save a life. Let's go across to our panel of doctors. And Dr. Sayyed, there are some incidences where young individuals have suffered sudden cardiac arrest while performing high-intensity exercise. Should people go through heart screening before starting a high-intense exercise regimen?
Yes, actually, the the sudden cardiac arrest in a the age or the sudden intense exercise is not the responsible. The responsible for this is the underlying cardiac condition. So that needs to be diagnosed and treated. Of course, if you see the American College of Cardiology guidelines, there are a few guidelines for which people should undergo these screening tests and what are those screening tests. The screening tests are generally ECG, echocardiography, and routine blood tests with electrolytes. Which person should undergo? The person who is suddenly starting a high-intensity exercise which was not doing it before, or a high-performance athlete who is going to perform a big event, that should again re-undergo the process of screening. And that's how we can diagnose few conditions like cardiomyopathies or few conditions in which this intense exercise is not allowed, is not to be done. So that we can prevent this.
All right. And Dr. Munot, how important is it for people with family members or relatives who have heart disease to learn and master the CPR technique?
So sudden cardiac death is a worldwide killer. This term has come into vogue because of the number of high profile deaths which have occurred all over the world. And it can happen to anybody, anytime, anywhere. And it is estimated that around 5 to 7 lakh patients have sudden cardiac death all over the country every year in India. And pre-existing heart disease is one of the most common causes for sudden cardiac death. Without any treatment, only 5 to 10% people may survive a sudden cardiac arrest out of the hospital. While with effective CPR, these survival rates can increase up to 30 to 50%. So this is why it is very important for people to be educated in CPR. Just the knowledge of CPR can triple, knowledge of CPR in a bystander can triple a victim's chance of surviving a out of hospital cardiac arrest. So at least one relative in every family should be aware of the steps of CPR. And as sir said just a while ago, everybody in the country should ideally be educated in CPR. People in schools, students in schools, colleges should be taught CPR. In corporate offices, there should be lectures for CPR, and the general public should be made aware. Yeah.
All right, a very important point, about creating awareness about CPR, and people in schools and even gyms must know CPR. Dr. Shah, after resuscitation, will the survivor be able to live a normal life?
Yes, that is the brightest part of CPR. After CPR, there is a very much good potential of a person having a complete recovery and leading a normal life. But not every CPR is going to have a successful outcome. The prerequisites for a successful CPR are that the bystander should initiate the CPR, the bystander should be reasonably well trained into techniques of CPR. The techniques of CPR are being available online on various videos. There are various NGOs who conduct free seminars either online or offline. And there are many devices available on which you can check your technique, whether you are performing CPR adequately or not. And post successful CPR, the cause should be found out and it should be treated properly. If all these steps are done correctly, then yes, there are people who have successfully recovered from cardiac arrest, leading absolutely normal, active, or even very active physical, mental, social lives. That should not be a taboo.
All right, and Dr. Saeed, if you could, talk about what the patient experiences. Does a heart attack always feel like a sharp chest pain?
See, the chest pain and angina are two different things. Chest pain can occur due to any organ or any structure in the chest, but angina is the pain which arises from heart. So one should be educated and should know what is angina, what is heart pain. The heart pain has some characteristics. There are two kinds of heart pain or angina. It is at rest or on exertion. If you ask me about the exertional angina, it has three characters. It is generally retrosternal, it is a discomfort, it is more on exertion, and it is reduced by rest. So if these are the characteristics, all three characteristics are present, it is angina, it is not other pain. So you should be aware. Or there is something called atypical angina. Out of these three characters, on exertion, retrosternal discomfort, and relieved by rest, out of these characters, only two characters are there. It is called atypical but angina still. If out of these three characters, only one character is present, probably it is a non-anginal chest pain, maybe due to gastric problem, chest wall problem, or it may be due to muscular problem. If you ask me specifically about the pricking pain, so we don't describe a cardiac pain as a pricking pain, except the covering of the heart, which is called pericardium. It has some issues, so it sometimes pricking pain is there. Otherwise, the pricking pain is generally because of the lung problems or acidity problems. The cardiac pain is generally mid of the chest, sometimes radiates to left and radiates to jaw, and sometimes up to the umbilicus. If the pain is above jaw or below umbilical, it is generally non-cardiac. But mind you, the classic anginal pain is present only in 30 to 40% of the patients. So the background of the pain is more important. Somebody is more than 45 of age, having risk factor for heart disease like hypertension, diabetes, the smoking history, alcoholic, or family history of heart disease, should be evaluated for any kind of chest discomfort or pain, for anginal pain, and that's how we can save lives.
Right. And Dr. Munot, if you could, tell viewers, what is the best exercise program for your heart?
So basically, heart is a muscle, and if you exercise regularly, your heart is going to get stronger and healthier. So how do you select which exercise to go for? So you should always start slowly. Select an exercise which you will prefer. First, try to ask yourself, what do you think is fun for you? Do you like exercising? Do you think exercising alone will be better? Do you need a trainer? Do you want to go to the gym? Do you want to work out in the park? So do you want to jog in the park? So, and whenever you start, you can start slowly and then gradually build up. For example, initially start with brisk walking, then go to jogging and then running. So there are three basic types of exercise. First is aerobic exercise. Aerobic exercise is what we usually call cardio. So cardio includes running, jogging, biking. And if you are moving during aerobic exercise, you are usually moving fast enough to raise your heart rate and make you breathe harder. But you should still be able to talk. If you are able to talk too comfortably, then you are not fast enough. And if you are too breathless, then you are just too fast. One more thing, if you are having any joint problems, then you can try to prefer swimming or walking instead of going for high impact activities on your knees. The second type of exercise is stretching exercise. So stretching will make your body more flexible. You can do stretching exercises 2 to 3 times per week. Stretching is usually done after you have warmed up or before or just after you have finished exercising. The third type of exercise is strength training. Strength training includes working out with weights, with resistant bands or with your own body weight, for example in yoga. So when you are doing strength training, it will help you build up your muscle bulk. So you can go for it for 2 to 3 times per week. Now how much exercise should you go for? So the American Heart Association recommends that you should exercise at least half an hour every day for at least 5 days per week. So which amounts to around 150 minutes per week, which is the minimum essential according to the American Heart Association. Now one more thing, whenever you are exercising, you should keep in mind certain precautions, especially if you are a heart patient. So you should always stop if you are having any pain in your chest, if you are feeling any pressure, if you suddenly have a breakout of cold sweats, or if you have any trouble breathing. So if you keep this in mind, you will be able to exercise safely. Yeah.
All right, so important points all to keep in mind. Thank you so much, doctors, for sparing your time and answering all our questions. Thanks for watching at home. Goodbye.